Hi and good evening, everyone. I'm Shivangi from the oDOc team, and thank you so much for joining us today in a conversation which I think is very, very important. It's around mental health of women. So last week, if you were there, we spoke about mental health in general, but today we will be speaking more specifically about mental health for women. So, unlike in the past, women nowadays have more responsibilities and live a more dynamic lifestyle, handling family, work, and everything else, which constantly pushes them to their limits. So, it's likely that most women would go through certain breakdowns at some point in their lives. Although completely avoiding these challenges or responsibilities are almost inevitable or impossible, there are better ways that women could resort to help them navigate through these tough situations and steer them towards clear waters. So, here to advise us on what we as women can do to make the most out of these tough situations and maintain good mental health throughout our lives is Dr. Malika Weerasinghe. So, just a quick background about her. Dr. Malika Weerasinghe received her basic medical degree from the Faculty of Medicine, University of Colombo, after which she obtained her postgraduate qualifications in psychiatry from the Postgraduate Institute Colombo in University of Colombo, followed by her postgrad clinical training in Sri Lanka and in Melbourne, Australia. Dr. Malika has experience in working in the mental health settings at the National Hospital Sri Lanka, Teaching Hospital Kalabovila, and Lady Ridgeway Hospital in Colombo. She shares a special interest in children and women's health, women's mental health. Doctor, thank you so much for taking time out of your busy schedule to join us today to speak about something which as I said earlier, which is very, very important in today's setting. So thank you so much for being here with us.
Yeah, thank you, Shivangi, and thank you, oDOc team, for inviting me.
Our pleasure, Doctor. It's an honor to have you on board. So without wasting any time, I would like to jump straight into questions if that's okay with you. To all the viewers who are watching, I will be asking a set of questions to the doctor, but if you have any questions that you would like me to ask her, please send us your questions via the comments section, and then I will ask them from Dr. Malika. So the first question I have for you, doctor, is as a result of the pandemic, the duties of women have increased significantly. The mothers have taken up the responsibilities of educating the children while balancing the daily responsibilities at home and work if they're working. So you have to cook, clean, order groceries, and make sure your financial reports are ready for the office, and look after your kids, teach them everything. So women are often told they can handle it all, but is this a healthy way of having it all? What help can women seek to better handle the stress that comes with all these responsibilities?
Yeah, actually, actually you have selected a very important and relevant topic to the experiences we are facing now. We all are facing. So, as you said, yes, the pandemic changed a lot of things in our lives, and the research and the inquiries into mental health, right? It showed that increased incidence of psychological distress in the form of depression, anxiety, and stress among all, but it was more in women. Right, so okay. I think it's not a surprise, like considering even in our society, like women, the mother, there's a huge responsibility for families' welfare. It in not only household tasks, but income generating as well as elder care and child care. Right? So because of the pandemic, lot of things change for women as well, like for example in the form of especially the routines, change in routines, right? Yeah. And the disruption to the support systems the woman has, and on top of that, as you correctly mentioned, the added responsibility of education online. So, actually, in my experience, I met a fair number of women who were psychologically distressed due to online teaching, basically, the children's online lessons. So I think one might wonder why a woman gets this much stressed up, because online lessons are easier than physical classes. So why would a woman get this much distressed? But actually, I think this is my experiences. This is more for women or mothers of primary school children. Okay? So because now anyway, children, they can't stay at one place. Their attention span is less. And anyway, at home, there are a lot of distractions. So there are so many interesting things than studies, obviously, at home. And on top of that, the parents, like teachers, expect the mother to perform teacher's role. Okay. So at the lot of expectations on the mother, lot of responsibility on the mother. This actually led to increase in psychological distress in women to the extent of seeking professional support. Right? So I think it's, as you correctly said, it's and something we need to discuss, right? And like how to help or how women can overcome this. Right? So first thing I want to tell you is now, in a crisis situation, it's difficult for anybody, right? And the problems are part of life. So we need to, the first thing is actually the acceptance. Yes, this is happening and we all are facing problems. Right? And the secondly, you need to adjust, right? Now this is a change. So see that now the online teaching, it's something is better than nothing, obviously, right? If no school for months or even years, so because of online teaching, to at least some extent, children can continue. Okay, so see, the women should start see the positives, right, and adjust to the situation, right? Because if let's say in a family, if the mother struggles to adjust to current changes, if she starts complaining about online education or whatever other changes, always feel bad about things, children in turn, children also will face it difficult to adjust, which will worsen mother's stress anyway. So women or mothers, adults are the role models for children. So see this as an opportunity to show the children, okay, these things can happen in life, we'll adjust. Right? So that's one. Acceptance and adjusting is one. Then having a routine. Right? So if like, because now a lot of responsibilities and a lot of work for the mother. So if she can have a routine, it will be easier for her as well as for the children also to organize themselves. And also thirdly, mobilize supports, whatever the support she can have. Like for example, she can let all the children in the family to help with younger children or teach younger siblings. Right? And even sharing responsibilities or even household tasks. So don't see this as a problem all the time. See the opportunities which are arising from this. Like for example, you can use this as an opportunity to teach life skills or other skills other than academic skills to children. So see it as an opportunity rather than an obstacle. So I think these are the basic steps a woman or a mother should take with regard to online education. And the other important thing is now, this is a supportive role you are doing. Like you are not the teacher anyway, you are the mother. So at this time, parents, teachers are also seeking help from the mother because they can't manage it alone. So don't expect to do it perfectly. You don't have to do it 100%. I know many mothers are stressed up because they want to do it perfectly. That's okay. Even if you miss something, even if the child misses something, that's okay. Don't stress yourself because children's brains are anyway growing. So when they go back to school, they will most probably catch up.
Great. Thank you, Doctor, for that, for saying how you accept it and then you adjust to it and then getting a routine. I think that's really important. You can apply to many scenarios in life, actually. So thank you for that, Doctor. My second question is, I think we all know that depression is one of the most common mental health issues that's come up, and more people have been talking about it recently. Many people go through these during these hard times also. So, but what hormones and hormonal fluctuations that affect mood causes depression for women specifically, and how best can we overcome it or manage it better?
Yeah, actually, it's a very important question when it comes to women's health. Now, you know, in different stages of woman's life, so many different changes in hormones occur, right? So, because there is actually there's a connection between especially hormones in the female reproductive system and the neurochemicals. right? So brain chemicals. So depression is actually caused by problems or changes in brain chemicals, right? So anyway, hormonal changes in a woman can affect brain chemicals and can in turn lead to mental health issues like depression or even anxiety, right? So when we talk about a woman's life cycle, like when we talk about the menstrual period, right? So in association with menstrual period, there are different changes in hormones, like hormones levels fluctuate. So closer to menstrual period, some women can develop mood changes. This is what we call premenstrual symptoms, or PMS. And in certain women, a smaller percentage, these symptoms could be so severe that they need professional help and treatment. That situation, we call it PMDD, or premenstrual dysphoric disorder. Okay, so it's very important that women are aware of these things so that they can seek help, because otherwise they will suffer silently. Right? Then secondly, the peripartum period, that's pregnancy and the period after childbirth. Again, a lot of hormonal changes occur, a lot of fluctuations. This also increases the woman's vulnerability to develop mental health issues like depression and anxiety during that particular period. So most important thing is women should be aware of this, and especially there are certain predisposing factors which increases a woman's vulnerability to develop mental health issues during this period. Like all women don't develop these mental health issues, right? We all know. So what are these predisposing factors? Those are the family history or a close family member having a mental health issue. So that means they get genes, like mental illnesses run in genes. So that it doesn't mean woman is invariably going to develop a mental illness during peripartum period, but a slightly higher risk. Right. And the secondly, women who had experienced mental health issues like depression in the past, right? So they are also at an increased risk. And then women who are experiencing ongoing stresses, especially we see practically due to marital conflicts, domestic violence. So because of these things, many women are under low ongoing stress. So women who are having these predisposing factors are at a higher risk of developing mental health issues. Then there's another stage of a woman's life, perimenopausal, around menopause, which we actually don't talk much about. But the research evidence shows that mental health issues like mood changes, depression can occur around menopause due to this hormonal. So it's quite important that women are aware of these issues so that they don't have to suffer silently and they can seek help.
Great, great. Thank you for that, Doctor. There was a question that came in, which is also anonymously. Someone had sent it to us. But it's linked to what you were just saying. So I'm just going to read that question out to you, Doctor. There's obviously not enough conversation normalizing postpartum depression. So what can new mothers do? How can people around new mothers support them the best? And what signs of postpartum depression should the mom or people who are around them look out for?
Yeah, now after birth of the child, especially for new mothers, it's a change in role, lot of responsibilities, and so it's going to be stressful, right? So women can they can feel tired, irritable, don't know how to manage things. So they can feel like that. But that's quite normal actually because of the stresses around physical as well as emotional stresses around that period. But in some women, as I said earlier, especially the women who have those predisposing factors I mentioned earlier, some can develop this condition called postpartum depression. Yeah? So it's actually a little bit different from symptoms of depression which we see in other people, right? So in mothers after giving birth, like within about first few weeks of life, they might feel like, especially they might sense that their confidence is low. Right? They are not comfortable in handling the baby. Right? And even some others complain that they don't have enough milk, whereas actually they are having enough milk, but they feel that they don't have enough milk for the baby. And also they might think that, okay, I'm not a good mother, I can't look after this baby. And some mothers are even rejecting. They are like they have the baby with lot of hopes, but after birth, like others are surprised, like family members, why is this mother doing this? So sometimes they feel like rejecting the mother, right? So that kind of thoughts, negative thoughts can occur. And apart from that, they can also have like they can't enjoy anything, like they can't enjoy the baby, right? And the bond, like they feel that they are not bonded adequately with the baby. And sometimes they are also surprised, why is this? Like they were expecting the baby, they were looking forward for the baby, but still they feel they are not bonded with the baby. So those are actually the initial symptoms which we frequently see.
Right, great. Thank you for that, doctor. I also have another question, which is from me actually, which came from your previous answer about mood swings just before a lady gets her periods, right? Around that. So I've noticed that many girls around my age, which is mid-20s, go through like major mood swings. How can we better manage it, doctor? Like, does journaling it help? Like, are there any tips that you could give us?
Yeah, actually journaling helps, like because you need to know when this is happening. So rather than like just keep memorizing, if you note it down, the days of the menstrual period and your mood changes. Now there are a lot of resources. Now you can, if you search, you can find like mood diaries, and certain journaling techniques are there, so you can easily track your mood. Right? So if you track your mood for about 3 or 4 months, then if it's PMS, you see this that mood changes are related to menstrual period.
Right.
Okay. So then think about the severity, like how is it affecting your usual work? It could be studies, job, or the relationships, right? So sometimes like maybe minimizing your whatever the workload, because for some people it could be physically uncomfortable as well. So if you can kind of minimize your work during that time, then the things like exercising, right? And then certain relaxation, like there are certain activities people practice, like it can be different person to person, right? Things which helps you to relax, practicing those things will help. And if it's so severe and difficult to manage, it's good to seek professional help.
Right, great. Thanks for that, doctor. That was actually really insightful. Going to the next question, doctor. We know that PCOS, which is polycystic ovarian syndrome, is one of the most common endocrine-related disorders in women of reproductive age. I think in the UK, 1 in 4 women have it. I think that's global figures also. What impact can conditions like PCOS have on a woman's mental health, and also taking like the contraceptive pill? What effect does it have on like the mental health of a woman?
Yeah, when we talk about polycystic ovarian syndrome or PCOS, so it's again related to hormones in female reproductive system, right? So as a result, there are certain very distressing symptoms, especially for women. Like for example, increased body hair, including facial hair, obesity, menstrual irregularities, and infertility. So which are anyway distressing for any women. Right? So as a result, they can develop mental health issues, especially depression. Right? So actually, some research has shown that depression could be the first presentation even of PCOS. Like they present with depressive symptoms, and then after that only other symptoms are recognized.
Right.
So realizing this, actually these clinics or medical settings where they treat PCOS, they have arranged mental health support. Even in Sri Lanka, certain clinics offer psychologist service. And so it's important for women to be aware of this and talk to the doctor so that doctor can refer you for extra support if needed. Right? Then coming to a second part about OCP, or oral contraceptive. Okay? Actually, like it's actually two-way. Right? So oral contraceptive pill is sometimes used to treat premenstrual symptoms, actually, that uncomfortable thing, and it's effective. Right? But at the same time, certain research had shown that oral contraceptive pill also can cause mood changes.
Right. Thanks, Doctor, for that. We're just getting another question from a viewer, also again, anonymous doctor.
Yeah.
Actually, I'm going to pause on that question for now, and I'm going to ask you another question, Doctor. So you mentioned postpartum depression, depression around menopausal time, and women's health, mental health in general. It's something that is not really spoken about as vocally as mental health in general, right? What do you think that we can do to increase the conversation around these topics and to bring more awareness? Where do you think we're lacking?
Yeah, I think it's one is lack of awareness, right? Because especially mental health literacy is low in our country. But now I see a good trend, actually. The younger generation, they talk a lot. They read, they find, they research, right? So I think first step is to increase awareness, read around things and learn about it. Then only you get to know that these things are there. Right? And then the second thing is actually stigma. It's for everybody. Like there's a lot of stigma around any mental health issue, and so it affects women as well. So it's not spoken openly. Right? Then other thing, what I see practically, like I work with women a lot. So what I see practically is women prioritize other things like family's needs. So basically, they don't have time to think about themselves. So little things, it could be a mood change or other things like irritability, feeling low, anything, they tend to neglect it or postpone, like until children grows up, until exams are over. So various things are there. And especially in our country, this elder care, the responsibility about their parents, like parents, the older parents, so it also falls on women. So they have to look after themselves. So I think that's why like women don't come up with these issues, and that's why they wait, and as a result they suffer with the negative impact on the family. I think women should be aware of that as well, like that they don't realize that they are doing everything in good faith for the family, neglecting their mental health, but they need to realize that their negative mental health, their emotional difficulties in turn can affect the other family members in a negative way.
Right, yes. Doctor, another question that which came in anonymously again through our DMs, which is linked to what you said, was they keep neglecting or don't come forward to talk about their symptoms or what they're going through. So this question is, what advice would you give women who are scared or unable to reach out to obtain professional health advice?
Yeah, again, see, now you need to realize the importance of your good mental health, right? Because as I said, now mother in our setting or any society, usually mothers are the managers of the family, right? They bear the huge responsibility, right? So I think you need to start talking about this. Women need, like me, most of the time women suppress their actual emotions. As I said, they prioritize others' needs, right? So that's why they don't come up, right? So I would say, start, increase your awareness, start talking about it, maybe even with your friends. Like you can share, like people who can trust, with whom people you can trust, you can share your experiences. Then you might realize that even others are feeling this way, others are experiencing similar problems, so we need to do this. And the other thing is, you can learn that other people might be using certain techniques to improve their mental health, right? Or maybe, like, for example, both of you can, like, many what I have seen is like they don't have hobbies. I usually ask, what's your hobby, or what do you do during your leisure times? And they say, no, doctor, I don't have time. Right? But think about yourself, think about self-care, do maybe get together with other friends or people you can trust and engage in some activity, and then again increase your knowledge about the services available in the country, the professionals who can support you at that time. So and come forward rather than hiding things. I have seen many instances where women especially are hiding, especially family issues, and they suffer in turn, right? But you have to be strong enough, like believe in yourself. You are stronger than you think. So if you have a problem, rather than suffering, come forward and seek help.
Right, definitely, doctor. Thank you for that. We're almost at the end of our webinar session for today, but I have one last question for you, which I think we can wrap up after that. So the question is, it's quite straightforward that women must have a strong and positive mentality to overcome the various challenges associated with their daily lives, right? But what advice would you give a person who's struggling to reach that positive state of mind, doctor? Is there a link between good mental health and like physical activities such as exercise and stuff you do?
Yeah, that's actually a good question. Yes, now there is research evidence that exercise, at least 30-minute walking, improves good brain chemicals. I told you that mental health issues are secondary to changes in brain chemicals. So the exercise actually can increase good brain chemicals, right? So it doesn't have to be very strenuous exercise or gym workout. Even simple things like maybe walking, cycling, yoga, or even dancing, those things also can help. And you can get together, maybe you can meet friends and engage with their things, right? So actually, for people who are depressed, we sometimes recommend exercise as part of their therapy plan. That's
Right.
so important. I think it's not a very difficult thing, right? So if you think about it and find time, any woman can have at least 30 to 40 minutes for yourself, for exercise, right? So I think that's something important all women should think of.
Great. Doctor, I know I said that was the last question, but there's another question that came through, which I think is extremely important in today's setting. So with the whole lockdown, everything, the number of women who've been suffering from domestic violence has increased significantly, I would say also. So it can be domestic violence, physical or verbal abuse. How can they seek help is my question. Like,
Yeah, that's very important. Actually, during pandemic, there were increasing reports of domestic violence, unfortunately, right? So, as you said, actually, they don't come up and they don't know what to do, right? So the help, and actually there are now in hospitals, right? In some hospitals, there are separate clinics for women who are victims of domestic violence, right? It's called Mituru Piyasa. There are units in certain hospitals, right, where they can come. Or mental health units are there in most of the hospitals, right? So there's a team there with the psychiatrist and even other members of the multidisciplinary team, like psychologists, counselors, social workers. So a lot of support are available. Right? Then there are certain other like non-governmental organizations also which help, right? So I think women should be aware of these facilities, the services available in the country, and seek help whenever they need rather than hiding things.
definitely. Thank you so much, Doctor. You touched on very, very important topics like seeking help with regards to domestic violence, like the last question, to the more taboo topics that people don't really talk about, like postpartum depression, depression around menopausal age, all of that, which is very, very important, very real, but most people seem to not be talking about it. So thank you so much for shedding some light on this and giving us information which I think is super vital for every lady out there. So thank you so much, Doctor, for taking your time to speak about this. And like you said, spreading awareness is something we at oDOc take very, very seriously with regards to mental health and all other health forms, basically. And we will continue to do so. So thank you so much, Doctor, for being a part of our session today.
Okay, thank you.
Thank you so much, Doctor. It's been a great session. Also, to everyone who's watching, if you would like to consult Dr. Malika Weerasinghe in a more private setting, you can always consult her via oDOc. So with that, I think we're coming to the end of the session. Thank you so much, Doctor. And to everyone watching, thank you so much for joining. Hope you guys have a great evening. Thank you.